This morning, our nation continues to rebound from the coronavirus pandemic. As things were moved virtual last year, leaving many of us home, some of us were left to manage the stress of it on our own. This week, I spoke with Dr. Ellen Astrachan Fletcher, the Midwest Region's clinical director for the Eating Recovery Center that's housed in Chicago. She's also a lecturer at Northwestern School of Medicine on how changed eating habits have affected the way we view ourselves and how it could be impacting our self-confidence. But more importantly, she spoke about how we can tackle this issue with self-care. It's new today on Good Morning Quad Cities. Dr. Ellen Astrachan Fletcher, thank you so much for joining us today to talk about this important issue. And we wanted to start with some basics. That would be really, how did we get here?
Yeah. Thank you for having me, by the way. And how did we get here? Well, I mean, the pandemic to start with, social distancing, isolation, constant change, fear of the unknown. All of these things during the pandemic really took its toll on people. In October, the American Psychological Association found that 61% of adults reported experiencing undesired weight change during the pandemic. A lot of people got on social media more than ever before. You're at home, you're kind of in your house. What are you going to do? People really hopped on social media. And the posts and messages about weight gain, about exercise, weight loss, all of these things during the pandemic, post pandemic, absolutely had a negative impact on some people. And we know that it's affected mental health in general and eating disorders even more so.
So how do we combat that then? We have this body anxiety right now. We're stressed about the way we look. I know that, you know, prior to the pandemic, maybe we looked one way and now maybe the clothes that we were wearing before don't fit us the same way. And now when we go to stores and we're hanging out with people, it can be stressful. It can be really you can set you back. How do we combat this?
Yeah, I mean, especially given that, people spend so much time in sweatpants and leggings, and now they're putting on their real pants again, right? And so you notice the difference. The first thing is that we encourage acceptance, right? Acceptance that really involves self-compassion instead of judgment. It's recognizing we've been through a ton in the past year and a half, and it has to take a toll in some way. So we encourage people to learn about and start practicing body neutrality, especially when they say body positivity is just too difficult right now. Body neutrality is basically, having enough respect for your body just so that you don't harm it.
And within your work, because you've been a practicing clinician for 25 plus years, specifically helping women treating eating disorders and mental health. How has the pandemic changed the way that you're helping people now, knowing that there are so many people, over half of people that were surveyed, saying that they had some undesired weight gain or weight changes?
Right. Well, I mean, the first thing, how has our practice changed from the pandemic is we've gone a whole lot more virtual. The first 2 months of this year, we saw a 90% increase in new patient calls compared to the previous year. So it's really people want the help. So we have as many people doing as many free assessments as we can each day, helping people find the right level of care, the right program. Where do they start? Do they need treatment? At what level? And just helping them work through what are their options, including on site as well as virtual.
Well, some mental health instances can be pretty severe. The mental health is sometimes, for some people, it's a taboo subject to discuss. How do I have that self realization? Or maybe I have a loved one that I'm like, I think they're struggling, but how do I have that conversation with them? That they need to seek help without offending them.
Well, it's either recognizing for yourself or helping your loved one or your friend recognize for themselves that when your thoughts or behaviors start to interrupt your life, if you start avoiding people or activities that you used to love, that's a pretty good indicator that it's probably time to seek professional help. And really focusing on health for the whole person. especially because weight itself isn't an indicator of health. So we focus on better understanding where you're coming from emotionally, understanding your patterns, your behaviors, and what might be contributing to that. And, at ERC Pathlight, we use a multidisciplinary team, and every patient has that multidisciplinary team. So you're getting, different viewpoints, psychiatrist, physician, psychologist, therapist, dietitians. We're all here to help.